Welcome to our webinar with Apex Biologix. My name is Kaho Fiafia, and we're so glad that you're able to join us for this special webinar titled Enhancing Your Regenerative Medicine Treatments with Exosomes. We're also honored that Tim Mosely has taken some time to present on the new developments of this very hot topic and incredible product. Before we begin, I wanted to share an announcement with all of you. We've been partnering with Advanced Regenerative Medicine Institute, ARMI, to bring physicians comprehensive regenerative medicine training courses. We've got one coming up in Dallas, Texas on October 12th and 13th with presenters like Dr. Richard Rosenthal, Dr. Aaron Kolodny, Dr. George Chang Chin, and Tim Mosely will also be one of the speakers presenting that weekend. It is a CME course if you attend the Biologix track, but we've also got an aesthetics track for those of you who might be interested in that. We are also very excited for the annual Evolve Conference taking place in Salt Lake City, Utah, February 8th and 9th of next year. There are over 20 practicing, well-respected physicians that will be presenting on a wide array of medical topics. There's also a business track with a breadth of topics that you can also attend, as well as focused panels on autologous and allograft tissues. There's going to be some great hands-on labs and workshops throughout the conference. And what makes this conference unique is that every attendee will have the opportunity to choose their own course learning. There will be about 8 different topics being taught on the hour, every hour throughout the conference, which will then create a very unique experience to that attendee. So very exciting conferences coming up. If you are interested or want to learn a little bit more, you can visit the Army website, which is advancedregenmedinstitute.com. Or you can also get information on these courses at the Apex Biologix website. To thank all of those who are attending our call today, we'd like to release a flash sale on exosomes. So we're very excited about this. With the purchase of 10 exosomes vials, you'll receive 2 exosome vials for free. So this is a value over $4,000. We will be sending out more information about this. It is a flash sale, so it'll only go until the end of day on Thursday, the 26th. But we will be sending out more information about these exosomes that Tim Mosely will be speaking about today. We'll be sending that out shortly after the webinar. So with that, we'll go ahead and jump right in. Just a little bit about Apex Biologix. Apex Biologix is a complete resource for regenerative medicine, providing physicians specialized training, comprehensive business services, and premier supplies to improve their practices and enhance the lives of the patients they treat. Again, we are honored to have Tim join us. And so just a quick bio on Tim Mosely is that he has been involved in academic and medical device research since the 1990s. And has a graduate degree in cellular and developmental biology from the University of California at Davis in the Department of Orthopedic Surgery. His academic research career has included pharmacology and toxicology, dermatology, and orthopedic applications that included pulmonary therapies, dietary effects on skin pathologies, tendon, bone, and cartilage tissue repair. He has training and extensive experience at Stage-Gate Technology Management, Team Leadership Performance Management, and Lean Six Sigma Continuous Process Improvement. Dr. Mosely has been involved in the field of regenerative medicine with Professor Harry Reddy and the creation of the UC Davis Center for Tissue Regeneration and Repair. He has managed preclinical as well as clinical studies utilizing stem cells derived from adipose tissue as well as bone. He has authored over 15 peer-reviewed publications, as well as various conference abstracts and presentations. So without further ado, we're going to turn the time over to Tim.
All right, thanks, Kaiho. Can everybody hear me? Or can you guys hear me okay? So I have a few goals that I'd like to make sure we address, or that I will address on this web call today. Is first of all, just to explain how cells signal and communicate with each other. dive into a deep explanation of what exosomes are, why the cell source of the exosomes is important, which are the cells and the signals, and then what the currently regulatory status is of exosomes. There's been a lot of information and misinformation that's on social media about exosomes recently, and so I just want to make sure that I have an opportunity during this presentation to explain that to everybody so that they're comfortable on what the agency has to say about exosomes and where we are. Excuse me. So the mesenchymal stem cell is the regenerative cell of the body. They're found in every tissue. Their names are different based on where they've been identified or what people think that they have identified from this. The perivascular cell, so anywhere there's blood vessels, there's going to be mesenchymal stem cells that are perivascular in nature. We have stromal cells, which are very similar in the fact that the stromal tissue is kind of like a spider web in a variety of tissues. This is usually where the bone marrow aspirate cells are considered these stromal cells. We have bone lining cells or lining cells of the tissues that are there. Really, the idea is that they're waiting for there to be an injury or a need for these cells to come in and shut down inflammation or stimulate tissue regeneration. And these cells can be found and easily isolated from bone marrow, from fat. They're identified in birth tissues, bone, etc. And so these cells, they're involved in this tissue regeneration and wound repair. They're anti-inflammatory by nature. And I like to kind of clarify that inflammation is a interesting term. And so when I talk about anti-inflammatory, I'm talking about this chronic catabolic inflammation. Angiogenesis and new blood vessel formation is also a form of inflammation because it's recruiting cells in and causing the cells to do something. And so angiogenesis or neovascularization is also an inflammatory process, but I will try and describe that as angiogenesis because essentially there are anti-inflammatory and pro-inflammatory mechanisms involved in wound repair. The mesenchymal stem cells produce a tremendous number of growth factors and cytokines, and that further clarify the communication. And then it's also the most studied cell in science, not only in academic research, but also in clinical studies as well. So the exciting thing about a mesenchymal stem cell is, besides the fact that it's an adult stem cell, is that it can reproduce itself, which means it can make copies of itself without differentiating. And so this reproduction, to be a true mesenchymal stem cell, you have to be able to show that it can adhere to plastic, that it can grow through 10 passages without differentiating. They also can differentiate into different tissue types, and this is really based on the environment that the cells see. How stiff is the surface that is attached to? Is there minerals? Are there growth factor signals? A variety of different things. And so these can turn into bone, cartilage, fat, skin, a variety of different tissue types. And it's really based on the signals and the environment that cell sees. So there's different ways that stem cells communicate. And there is the paracrine action, which is a local signaling. And that's where the cells are going to produce some signals that will go to nearby cells. Autocrine, which is where the cell will signal itself. The autocrine signaling is usually a negative feedback loop where the cells will start producing growth factors, and when there's enough in that environment, it signals back to the cell to stop producing that. Juxtacrine is where it's essentially cell-cell contact. The example that I like to use is that, as cells are growing, when they come into contact with each other, they get this juxtacrine signaling, which will happen through kind of gap junctions or contact, which will stop the cells from dividing. So it's kind of considered contact inhibition. This is a signal that is messed up during tumor growth, and when the cells grow into each other and they're messed up, they'll keep proliferating even though they come into contact with each other. And then there's the endocrine signaling, which is primarily going to be hormone signaling, which will be long distance signaling, as opposed to the paracrine local signaling. So the role of MSC in tissue regeneration, as I mentioned, is going to be this anti-inflammatory effect. These cells are found everywhere in the body, and they're waiting for signals to tell them to activate and start repairing that injury. And so the cells can have a lot of different mechanisms they can do. They can directly differentiate into the cell that's needed. My career as a cell biologist and working in stem cells has been really focused on this differentiation. Is how do we isolate the cells from one tissue, transplant it, and get it to turn into the tissue that we're interested in or we want to repair. I mean, it started with doing adipose stromal vascular fraction and delivering that for cardiac applications, treating AMI, trying to revascularize the damaged part of the heart. Moved on to bone and cartilage, where you isolate the stem cells from bone marrow or from bone itself, and trying to get those cells to turn into the bone. And what we found out is that most of those cells that we transplanted, through the process of isolating the cells, the process of cleaning them and preparing them and implanting them, a majority of those cells would die in that process. And so you'd get some early signaling, early regenerative benefit from the cells, but those cells that died would pop open, releasing their DNA, releasing their nuclear proteins and nuclear membranes and cell membranes, lysosomes, Golgi apparatus. I mean, everything that's in a cell will end up in that extracellular space. And that's all cell debris and foreign material that needs to be cleaned out. Once that happens, you need macrophages and cells that will come in and remove that foreign debris. That whole process is this catabolic inflammatory response that is detrimental to your goal. And so the whole idea of what we're talking about today is delivering the signals without delivering the cells. And you're going to get that regenerative benefit of the mesenchymal stem cell, the anti-inflammatory, angiogenic, matrix production, without the cells that can get in the way of that healing process. And so the way the cell does that is through this paracrine signaling, which is delivering growth factors, cytokines, chemokines, as well as the exosomes and extracellular vesicles. So what are stem cell growth factors? These growth factors are proteins that are produced by the cells to communicate to other cells and instruct them on what to do. Cell-cell communication is perfect communication. When a cell signals something, the other cells in the surrounding area know exactly what it means. As opposed to our communication, this presentation with me is not perfect communication. I know people will misunderstand. I'm going to say something that won't make sense to somebody. That's not perfect communication, but cell-cell communication is perfect communication. And so that variety of growth factors, variety of cytokines and chemokines, as well as the extracellular vesicles signaling, directs those cells in that surrounding environment, in that paracrine environment, exactly what they need to know. And so that's going to tell the cells, these growth factors signaling by themselves are going to tell the cells, hey, do we need to grow? Do we need to migrate? Do we need to shut down inflammatory signals? Do we need to shut down IL-1 and turn on IL-4 and IL-10? Do we need to turn on TGF-beta and shut down other signals? We need to revascularize this tissue, so we're going to produce the VEGF and EGF and FGF. We need to grow more extracellular matrix, produce more proteoglycans and collagen and hyaluronic acid. Or do we just need to tell our cells to divide and increase cell density? So these are all signals that are controlled by the growth factors and cytokines, and they have a pretty long process on how to do it. And I'm going to get into explaining how these growth factors signal and produce their signal. Some of the other proteins that are stimulated to be produced by mesenchymal stem cells, and I mentioned some of them. You have VEGF, FGF, EGF, TGF-betas, extracellular matrix proteins such as collagens and fibronectin. One I'd like to draw your attention to are the TIMPs. These are collagenase inhibitors. These are very important in maintaining the extracellular matrix that's there. It's going to prevent that collagen breakdown. So most of our aging in our skin is from matrix breakdown and loss of volume. So if you can prevent that by blocking these collagenases, then that's a huge start. But then you start producing the collagens and producing the proteoglycans and hyaluronic acid. That's going to cause the water to come in and bind to these hydrophilic proteins. And so it's helping to restore tissue volume. Not only in skin, but also in other tissues such as cartilage, can have the huge benefit by having this combination of extracellular matrix proteins, growth factors, and proteoglycans involved in this regenerative process. So I like to really describe how a growth factor and receptor, how they interact on the cell surface, because it kind of lets you know what is expected when you hear somebody talk about, we're delivering a growth factor to, that paracrine site, what is happening with those growth factors. And so this is an example I pulled out of a textbook showing that FGF comes and binds to these two receptors, which are the FGF receptors. And when when it comes in and binds, it brings those receptors close together where they activate each other. And it's called a phosphorylation activation, which is essentially signal transduction. So you've brought that signal from outside the cell through the cell membrane to the inside of the cell. If you zoom out on the cell, that's what this next image is. You can see that this growth factor binds to the receptor, and you have several different signaling phosphorylation cascade that happens, where active transcription factors and DNA binding proteins will merge together, unwind the DNA, and transcribe that DNA into messenger RNA. That messenger RNA is transported out of the nucleus into the cytoplasm, where ribosomes will bind onto it and produce your new protein. That new protein can be packaged to be a transmembrane protein, an extracellular matrix signal, or some additional signaling that's going on inside the cell. But this whole process is pretty cumbersome, where we can try and avoid some of that signaling cascade by just delivering the messenger RNA and microRNA directly to the cell and skipping this out. This might seem pretty complicated back to kind of high school or college biology, but actually what's happening in the cell when a growth factor comes and binds to the receptor is something more like this, where there's a lot of negative feedback and positive processes that are going on, showing how these different interactions with the DNA and different messenger RNA production is going on. And I don't expect you guys to know this. I'm sure there's probably some people in the audience that do understand this, but it's just, I want to let you know it's much more complex than my simple cartoon that I started with. So how do cells communicate? It's through the secretome. The secretome is everything that's secreted from the cell, and so these are going to be your signaling proteins, which are growth factors, cytokines, and chemokines, as well as the exosomes, which are lipid vesicles. These lipid vesicles contain proteins, messenger RNA, and microRNA. So the messenger RNA is essentially the on signal. It will turn on protein production, while microRNA is essentially the off signal or off switch, because it's a small reverse sequence of messenger RNA that will bind to messenger RNA and turn it off. An exosome will not have the same mRNA and miRNA in the same vesicle, but they could be turning off one pathway, for example, chronic inflammation, while turning on angiogenic signals or anti-inflammatory signals. So moving away from textbook images, this is one of my images that I created. The blue field is a 30 micron cell example with the nucleus and the DNA. The size of an exosome is this tiny little dot, the 30 nanometer. It's 1/1000th the size of a cell. When you see something that size, it's easy to question, like, how can that change the signal or reprogram a cell. And it's not going to be a single exosome that does it, but will be a tremendous number of exosomes that are produced by the cell that will go into that extracellular space and do that paracrine signaling to the surrounding cells. And so that combination of exosomes will have a combination of messenger RNA and microRNA along with the growth factors and cytokine signaling to reprogram the patient's own cells in that environment. So exosomes are actually pretty complex little vesicles. They're lipid bilayers, exactly the way a cell is. They have receptors on the outside of them that have been shown to track the same way that stem cells do to the site of injury. They contain these transmembrane receptor proteins, transmembrane communication proteins, cholesterol in the membrane. They also have the messenger RNA, microRNA, as well as cytoplasmic proteins that are inside the vesicle. So it's not just a simple secretion or a cell factor. These are actually a pretty complex tissue product that is being produced by these cells. So I'm going to go back a little bit, and I'm going to actually start a video. I have a video that will show how exosomes are created and what the exosomes are. I think that the audio on the video should play directly for everybody, but if not, you might have to.
Direct Biologix was created to expand the science of cutting-edge biologic technologies through research and commercialization of the naturally occurring proteins from allograft tissue, compliant with FDA standards for 361 HCTP product. Cells by nature work to heal, repair, and reconstruct the body. Science shows us a revolutionary way to provide true stem cell therapy, which is to provide therapy to the patient's own cells by modulating the cellular activity. This happens by introducing the patient's cells to a healthy and younger combination of naturally occurring growth factor proteins and exosomes. A growth factor is naturally occurring protein capable of stimulating cellular growth, proliferation, healing, and cellular differentiation. Usually it is a protein or a steroid hormone. Growth factors are important for regulating a variety of cellular processes. Let's find out how exosomes are made. Inside the cell, a cell membrane forms inward, forming a special type of lipid vesicle called an endosome. Then the proteins, microRNA and messenger RNA, invaginate the endosome's membrane, forming the exosomes. Endosomes then fuse with the surface of the cell, releasing the exosomes outside of the cell. Due to the observation of this process, historically exosomes were believed to be a waste byproduct of cells. But when researched further, and it was discovered that, in fact, these are the mediating mechanism involved in direct cell-to-cell communication. These produce an anti-inflammatory response due to the communication from the many proteins that down-regulate inflammatory proteins. Other proteins will then recruit stem cells to the area that will help unregulate these cells to proliferate and promote organized healing through the regulated process. Then once the task is complete, there are additional proteins that tell the cells when the healing has been completed. These exosomes, with the presence of over 1,000 plus growth factors, are being regarded as one of the purest forms of stem cell therapy. In their natural state, they offer proteins and no DNA or potentially harmful byproducts that can be found in other therapies.
Okay, let me see if I can get back to the presentation. There we go. Okay, it's like kind of a high-tech process. All right, so I got this back. So, I mean, one of the take-homes is that these exosomes don't have any DNA in them. They're not seen as a foreign tissue. These are just a natural produced cell signal. And so this is going to tell surrounding cells in the paracrine area to reprogram their environment. So the whole idea is that we're going to shut down inflammation, turn on matrix production, turn on angiogenesis. We also have a tremendous number of tumor suppressor proteins that are produced and brought along with this as well. So the source of exosomes is hugely important. You know, you can collect exosomes from almost every tissue fluid in the body. The question is, what are they signaling? So if you can collect exosomes from milk, urine, amniotic fluid, interstitial fluid, blood, bone marrow, what are these different signals? What cells are making them? And what are they signaling the other cells to do? Hugely important. So, you know, milk, you've got signals that are probably directing fat and protein for food production. Urine are primarily waste products. Amniotic fluid, you have anti-adhesive proteins, epithelial cell fluid secretions, primarily albumin, which is the main protein in amniotic fluid. Interstitial fluid, you've got extracellular matrix support, proteoglycans. Another thing about amniotic fluid is that full term at birth, the amniotic fluid is primarily fetal waste products. So fetal urine is probably 90% of amniotic fluid. So you have a lot of the amniotic companies coming out saying that they have exosomes. I'm sure they do. But what's the source of the cell and what are the signals is the question you need to be asking. In blood, you have the clotting factors and immune support. Bone marrow, you have hematopoiesis, immune support, the stem cell supply from that stromal vascular fraction, or the stromal fraction of bone marrow concentrate. Something that is important to note, and this is why I highlighted it in red, is that cancer cells will produce cancer exosomes. A lot of the exosome research came out of cancer research and saying, hey, why do these cells metastasize? And so they showed that these cancer exosomes that are from cancer cell lines produce signals that are promoting cancer. And so if you dive into Medline and you do your literature search on exosomes, a majority of the papers are going to come out talking about cancer research and the role that exosomes play in cancer cell communication. But again, you have to step back and say, what cell source was it? What environment was that cell seeing? And what is it signaling? And a cancer cell will produce cancer exosomes. We've moved to the mesenchymal stem cell, which is collected from bone marrow from a healthy individual, and these are going to produce regenerative exosomes and regenerative growth factors. So these are going to be extracellular matrix support, angiogenesis, which is that new neovascularization, anti-inflammatory signals, tissue repair, as well as tumor suppressors. So we've done a tremendous amount of proteomics and RNA analysis of our products, and we've shown that over 1,000 growth factors and cytokines are identified. And I'm not going to get into what each one of these are and what they do. I just kind of put them into more broad categories of angiogenesis, chemotaxis, and migration. We also have tissue and wound repair, some of the tumor suppressor proteins that we've identified, extracellular matrix development and repair signals. As you can see that TIMP1 and TIMP2 collagenase inhibitors are there, as well as inflammation and cell support. And so the question, how are these exosomes characterized? Our products are characterized by proteomics and genomics for the growth factor cytokine quantification, as well as identification, messenger RNA and microRNA evaluation. But then the particles themselves are characterized for their size distribution and the nanoparticle quantification. And the way we do that is with this machine called the NanoSite. It uses a light scattering and a fluorescent cell exosome identification, and it uses a technique called Brownian motion analysis. And what that gets into is this slide is usually animated, but you can see all these little particles here. They're moving around, and you track those particles and identify how they interact with each other and how they move. And you plug it into this equation that was published by Albert Einstein in 1905, and it will give you a quantity and a size distribution of those particles based on how they move relative to each other. And this Brownian motion was actually identified by dust particles in a room that had no air movement, and seeing that some dust particles are going up, some are going right, some are going left, some are going down. And it's really the nuclear interactions, atomic interactions between the different particles that are determining their motion and where they go. And so with that, we're able to use that. And in the background of this slide, you can see is an image of our actual particles from that NanoSite machine, and it gives you the size distribution and concentration of the particles. And if you look closely, you can see that this is 3 different runs that are overlapping each other, showing that our size distribution is between 30 and 150 nanometers, and that we have over 10 billion exosomes per mil. So I guess I want to go back to that slide briefly. This greater than 10 billion exosomes per mil is the natural number of exosomes that are produced by these cells. So there's not some, super concentration. I've heard some people talk to me about, how having that many could be dangerous, but this is a natural number that are produced by the cells. If another company has exosomes that are at a lower concentration, it's just because they're being diluted. There's a variety of different misinformation out there about what exosomes concentration should be and what they are. This is just the natural number that are produced by the cells that we have in our environment. Another question that comes up is the age of the exosome. There's companies out there that say that amniotic exosomes or placental-derived, birth-derived exosomes are better than bone marrow-derived exosomes. So just so you know that the true source of the exosomes, it's important for it to be a mesenchymal stem cell, not just a random cell collected from a tissue digest. That you want to make sure that it's a true mesenchymal stem cell, because that's the regenerative cell. So whatever characterization is required to be done to show that the surface markers on the outside are the markers that are identified to be mesenchymal stem cells. The cells can proliferate that 10 passages without differentiating, that they can trans-differentiate into the multiple lineages of bone, fat, or cartilage. And so we've done all of this thorough characterization of our cells. We've done all the karyotyping, cell characterization, so detailed that we actually have a master record on file with the FDA for our cells. Because there's an unknown regulatory environment right now with exosomes, our product is, marketed as a 361 tissue, but there's a lot of noise out there in, as I mentioned, in social media and other things, that the agency is moving to regulate these as a 351 tissue, which is a biologic drug. Direct Biologix has been aware of that for some time. All of our manufacturing, all of our processes are done at a drug therapeutic level. So we have a master record on file with our cells. With the media that our cells are fed with is, chemically defined, xeno-free, serum-free, with the idea that if anything changes, our process is absolutely locked down. Everything is done in GMP facilities to GTP requirements. Every lot is validated, processes, reproducibility, sterile tested. Huge advantage with exosomes over cell therapies is that these exosomes are so small, that 30 to 150 nanometers, that you can pass it through a sterile filter and remove any potential bacteria or molds or anything that somehow got into the process. And what this would do is avoid any issues similar to what Livion had gone through with having a bacteria get through the process. And so not only are we sterile filtered, but then we also are tested for sterility to meet all the USP 71 requirements for sterility. So maybe that was a little bit of a tangent, but just making sure everybody understands where we are with this. So what can exosomes do? They're involved in tissue regeneration. They decrease inflammation, reduce matrix destruction. They've been shown to be involved in skin health, can reduce osteoarthritis issues, involved in muscle repair, as well as can be effective in treating autoimmune diseases. So how are exosomes regulated? They're regulated as a 361 HCTP product. It's regulated solely under this 21 Code of Federal Regulations 1271 without a pre-market approval if it meets all four of the following criteria. These four are minimal manipulated, homologous use, not combined with other articles other than water or preservation agents, and does not rely on the metabolic activity of cells unless it's autologous or from a first, second degree born relative. So for the first one, the mesenchymal stem cells that we're using with Direct Biologix are maintained undifferentiated the same way they come out of the bone marrow. We don't do any differentiation of the cells. They're homologous use. Mesenchymal stem cell exosomes are found in every tissue of the body, as we described, and that's where homologous use falls into it's being used the same in the donor as it was in the recipient. Not combined with any articles other than water sterilizing agents or preservation agents. Because we're not delivering cells, there's no DMSO. We do have an encapsulation with it to protect the exosomes and the growth factors from denaturing or from enzyme digestion, and it just protects them during that freezing process, and which it falls under this preservation agents. And then we aren't delivering any cells. There's no foreign DNA, no cells, and so it does not rely on the metabolic activity of cells for its action. Another thing I want to pull out and draw your attention to is according to Part 291 of CFR 1271, it's required to have traceability from your donor to the consignee or final disposition, and that's essentially traceability because it is a tissue transplant product. So I have some preclinical evidence as well as a few clinical cases that I'm going to talk about. But just so you know, I'm not going to talk about protocols or procedures. As a company, we're keeping this as intended for homologous use. Those physicians that have procedures they're currently using, that's great. If you want to talk to another physician and find out what their protocols are, what they're using the exosomes for, we can put you in contact with peers so you can have a direct peer-to-peer conversation. I'm not a physician, so I don't want to be talking about procedures and protocols and how to treat patients. This is a 361 minimally manipulated product for homologous use. It contains no DNA, and the following slides are for educational purposes. So for skin care and wound repair, this is a really interesting paper. So these exosomes were derived from mesenchymal stem cells, and they showed that they can accelerate wound healing. But not only just accelerating the wound healing, but that they track and deliver their cargo to the cells surrounding that wound. And so what they did is they created a wound on the back of these rats and delivered exosomes that were dyed with a fluorescent marker. And they showed that when they delivered the cells IV, they homed to the site of injury, and they delivered their fluorescent cargo to the cells, and those cells maintained that fluorescent signaling out to 3 weeks. Now, the whole idea of exosomes is to deliver that messenger RNA, microRNA, to reprogram the cells to change their status from a chronic inflammation to a regenerative cell. And so the idea is that the exosomes are going to deliver their particles, their nuclear or messenger RNA and microRNA to the cells to change their process. But this paper is really great in showing that the wound healing was accelerated with the exosomes, but also they tracked to the site of injury and delivered their signal to that. So the current treatment protocol for joint arthritis, as recommended by the American Academy of Orthopedic Surgeons, is you show up there with arthritis and they'll say, hey, you need to lose weight. You also need to start doing some gentle exercise. Let's deliver some NSAIDs, maybe a cortisone shot to see if that is an acute injury that needs time to reduce that inflammation. If that doesn't help, you're going to go on to joint replacement. That's the AAOS recommended treatment. My concern is that they've left out the opportunity for biologics to play a role in this regeneration. And that's where I believe that exosomes, where we've seen some benefit from stem cell delivery, but by using the exosomes and moving away from the detrimental effects of cell delivery and just delivering the signals, we can have a tremendous benefit in that. So what are they going to do to help osteoarthritis? They deliver these trophic factors, these growth factors and cytokines. This anti-inflammatory signals are going to be in there. These signals to inhibit cell death, so keep the cells alive. The TIMPs are going to block collagenase breakdown. You're going to stimulate new blood vessels, not in the cartilage because that's an avascularized tissue, but in the synovial fluid as well as the fat tissue in there. And then creation of new cartilage is kind of an interesting way to state that, but it's not going to be grow cartilage where there isn't cartilage, but it can increase the cartilage matrix volume. So the cells themselves will turn on signals to produce proteoglycans, collagens, hyaluronic acid, which will increase the volume of the tissue. If you have a joint that's bone on bone, you're not going to create new cartilage by delivering exosomes, but you can reduce the inflammation, keep the cells alive, and increase the volume of the matrix there. This is a preclinical study of using mesenchymal stem cell derived exosomes and show how they protect cartilage and bone from degradation and osteoarthritis. This paper is from Nature Scientific Reports, showing that the exosomes from mesenchymal stem cells reestablished chondrocyte homeostasis, protected the chondrocytes from dying, and stimulated an anti-inflammatory environment. This is an example, a case example from Dr. Scheinkopf in Chicago. He used to be chairman of orthopedics at Rush University. He's now in private practice. This patient was a firefighter that fell on the job and hurt his hip joint. He's moved on to advanced post-traumatic osteoarthritis, long-term unsuccessful pain treatments. He has hip impairment and disability, cane dependent and limping. He cannot enjoy a night of rest because of the hip pain. He was treated with the exosomes, and 7 months post-treatment, he's still free of pain, able to sleep through the night, able to walk without assistance. He was able to walk out of the clinic after being treated with reduced pain, and he's contacted us about wanting to be a spokesperson for our company based on his excitement about the outcome that he's had. This paper, even though it's not directly related to exosomes, I believe it is, and the author of the paper believes it is. So this was a bone marrow concentrate that was delivered interdiscally. In these 20 patients, their VAS was 80, which is 80 out of 100 for worst imaginable pain. Their ODI was near crippled, is at the very top end of severe disability. They delivered bone marrow concentrate to these discs of these patients, and at 3 years they moved to 27 on VAS and 19 on ODI. So 27 out of 100 is great outcome, but then 19 is down into the from almost the top of severe disability down to minimal disability. And then at 5 years, that continued out to a 21 VAS and a 14 ODI. Now, we don't believe that the cells that delivered stayed there, and I mean, maybe some of them did, but a majority of them would die in this process, mainly because the disc is poorly vascularized and a pretty harsh environment. But we do believe that the cells that were delivered signals to reprogramming the existing cells there to stop that further degradation and produce more matrix, which would essentially translate to reduced pain. So this is what our product is. It's these regenerative mesenchymal stem cell derived lipid vesicles derived from mesenchymal stem cells involved in cell-cell communication. They're approximately 30 to 150 nanometer in size, sterile filtered, all processed under GMP, GTP processes and sterile filtered into these vials. We deliver more than 1,000 different growth factors and cytokine proteins, along with the messenger RNA and the microRNA. So I'm not sure how the microphone works for questions, but I'll move it back over to the host of the meeting.
Thanks, Tim. Great information. We do have a few questions that were submitted, and so I'll go ahead and just ask you those questions, and if you can just provide a brief, short answer. So the first one here is, what is the differences between BMC-derived MSC exosomes and perinatal-derived MSC exosomes?
Yeah, no, that's a really good question. So the idea is that the exosomes are produced based on the environment that the cell sees. And so I know that there's another company out there that has birth tissue-derived exosomes from their cells. And we have ours from 18 to 25-year-old bone marrow donors. And people are like, oh, wow, we're going to get a much younger, healthier production of exosomes from perinatal tissue or birth tissues than we are going to get from an adult tissue. That's absolutely not true. The mesenchymal stem cell, if it's a true mesenchymal stem cell, responds to the environment that it's in. And so the environment that the cell sees determines what exosomes and what growth factors are produced by that cell. If it's not a true mesenchymal stem cell, then that's going to vary all over the place, what your results are going to be. And so the idea is that having a reproducible cell that, for example, our bone marrow derived mesenchymal stem cell with a master record on file with the FDA is a thoroughly characterized cell. Now, I don't know, I can't talk about the placental-derived mesenchymal stem cell or placental-derived cell, besides what I've seen on the internet with, isolating the plump cell from a placenta. But if I took a placental-derived mesenchymal stem cell that had all of the criteria for a mesenchymal stem cell and put it in my system, it would make the same exact exosomes and growth factors as a bone marrow-derived mesenchymal stem cell. Because based on the definition of a mesenchymal stem cell, it has that ability to differentiate, it has the ability to proliferate, all of those requirements. So it's kind of like saying, like, a cell, does a placental cell make different collagen than an adult mesenchymal stem cell? No, the collagen is collagen. The cell knows what to make, and it's responding to its environment and not necessarily the age of the cell. So hopefully I answered that question.
Yeah, great. Thank you. Next question is what resources do you recommend that you would provide physicians or that would provide physicians knowledge on the correct number of exosomes for any given clinical procedure?
Yeah, so I'm not going to give out dosing or procedures, kind of as I mentioned during my talk, because I'm not a physician. We have the exosomes come in different volumes. So we have a 1 mil, a 2 mil, and a 5 mil. And, you know, I've heard physicians using a variety of different concentrations depending on what they're using, whether it's for hair restoration or skin or wound treatments, burns. It's kind of all over the board, so I'm not going to make a recommendation. If anybody wants to talk to a physician, we have weekly webinars with specialists in different specialties, whether it's hair, whether it's pain management, orthopedic sports, and you can have those discussions with a physician in a peer-to-peer basis rather than me trying to discuss that as a non-physician.
Definitely, thank you. And just for a reminder for all those who are on the call, we have and feel free to reach out to our team here at Apex Biologix, and we can find the right peer-to-peer call for you to be a part of, so you can ask more clinical questions. Another question, Tim, here is how can exosomes help senescent cells? Sorry.
So, that's a really good question as well, because, you know, as we get older, I'm talking about 60, 70, 80-year-olds, the ability to heal and repair is inhibited. And so that's why, young 18 to 20-year-old that falls and breaks their bone, you're not worried about the bone not healing, you're not worried about non-unions, but an elderly person that falls and breaks their hip, you're like, yeah, okay, this probably isn't going to heal. How stable can we make them, or do we just need to go right in for a hip replacement? And so the idea is that the exosomes are providing these signals that are going to activate the cells that are surrounding that wound, and so that injury. And so that's what these cells are going to do. They're going to go and activate the senescent cells in that environment and get them going. And so that's through this paracrine signaling, where they're going to fuse with the surrounding cells and essentially wake them up and get them active in that healing process. The other process would be if somebody has a chronic injury that is not healing and you've got this catabolic cascade going on, the exosomes will go in and shut down that catabolic inflammation and turn on this regenerative signaling in that healing process. One of the original ideas that we came up with and as part of our IP was treating gut inflammation with exosomes and delivering them the same way you would probiotics to shut down gut inflammation and allow your body to heal itself once you have that inflammation shut down. And so that's probably one of the major mechanisms of the exosomes, is this anti-inflammatory and regenerative signals that are coming on at the same time.
Great. One last question until we end our call or conclude our call. This is a clarification. Someone was asking about when you discuss the CFR 1271, if you can clarify if there are individual IDs for traceability.
Yeah, so every lot we have is traceable back to that donor. And so not only can we see the donor, but we can see the process cycle that was done. We can see the packaging cycle. We can see we can go back to all of the master batch record files for that tissue. So that's part of the traceability, is that if there's ever any deviation in the process or any hiccup in the process, we have that identified all the way back to the donor and to the recipient. And so that's kind of a requirement for any tissue product out there. And that's the FDA says, hey, we want to make sure there's traceability, that if there's ever a hiccup later down the line, we can find out who received that or whatever. There's not any anticipation of that, but having that in place is an FDA requirement, which others in the market don't have that in place.
Great. Well, thanks again, Tim Mosely, for joining us on this webinar. We learned quite a bit from your presentation. There were some questions that were submitted, some dealing with the clinical applications as well as different protocols. With those questions, we will be reaching out and just trying to help you better understand some of the information that was discussed today, as well as the product of the ExoFlow. We thank all of those who were able to join us this afternoon, and a recording of this will be sent out, as well as information about the promotions and the announcements that were made earlier. So thanks again, and Tim, thanks as always.
Yeah, my pleasure.
Okay.
Thank you guys for coordinating all this.
Of course. Have a good one.
All right, you too.